Hi, and thanks for joining us here at Mandel Vision for our very first uncensored Mandel Vision Facebook Live session. My name is Kim Prochi. I'm the clinical administrator here, and I am very happy to introduce you to one of the true pioneers of laser vision correction, Dr. Eric Mandel.
Hi.
Hello, and hello to all of our viewers. Dr. Mandel, having performed laser vision correction for the past 30 plus years, how do you determine who is a good laser vision correction candidate?
So that's a fantastic question that we can begin with. First of all, my patients are overall, vast majority, very, very happy. So how do I get to very happy patients? I spend a lot of time with my patients, usually around 2 hours, for a completely free evaluation. If you've been told in 5 minutes that you're a candidate, you should think twice. It takes a long time, both in examination and time with the doctor to educate you to know that you are a good candidate. So what do? The first thing is, I'm going to examine you. I want to make sure your eyes are healthy. I want to know that your shape of your eye is a normal shape. I want to know the thickness of your cornea is a normal shape. And one of the things I'm doing with you while you're there is I'm going to be showing you all of the tests and explaining at whatever level that you're coming from, either well-educated or not, that you understand why I have decided that you're a candidate or not a candidate. So that time that you're going to be there, you want to dedicate that time for your only pair of eyes that you are going to be educated correctly. So to get great outcomes, we have to turn away a good amount of patients. I turn away over 20% of my patients. I don't want to turn people away if they're good candidates, but the truth of the matter is many people are not optimal candidates for this procedure. So what else do? We do the shape of the eye, topography. We do tomography, a fancy word for knowing how thick your cornea is, how it thickens in different places. We want to make sure that the cornea is stable. We want to be operating on a cornea that is one that is perfectly biomechanically normal. So how do we know that? We look to the micron at weaknesses in the eye. Think of your cornea as a dam, and make sure that the dam is made out of little bricks, and say some of those bricks are loose. I want to know that beforehand, and I have machines. One is called a pentacam or tomography that can look for these little weaknesses. We'll look and see that you have an eye that is good, that you're not in the 20% that I turn away. We're going to also make sure that both of your eyes work together. We're going to discuss what happens with you in the future, talking about what happens in reading glass in the future, what's going to happen today, how quickly you can be able to see. So in order to get good results, that's okay. We don't look for good results. We want to get superb results. And to get superb results, we're going to have to turn away a certain percentage of people. Just this morning, I turned away 3 people this morning who were not good candidates. The majority of people who came in this morning were not good candidates. They were disappointed, but incredibly relieved to know that the time I took with them, they were not a good candidate. And I know that 2 of those 3 probably would have been accepted someplace else that didn't have all of our screening tests. And so that is really important, that you put the time that you're going to have your only pair of eyes to be fixed. You want to make sure that you've done all of your due diligence. Most of our patients come here by referrals from people we've already done, but I want you to go and do due diligence first and educate yourself about the procedure, about the doctor that you're considering, and he or she should answer all your questions. Write down all of your questions to know that you're a good candidate. You're going to be nervous no matter what. That's normal. Somebody's going to be fixing your eyes. But also realize that at the end you're going to feel confident. If you don't feel confident, then that is not a good thing. I want, when you leave here, to feel confident, to know what to expect, and that is how we begin to get our very, very, very good outcomes.
Can you tell us about LASIK and PRK, the 2 laser vision correction procedures that we perform here, or that you perform here at Mandel Vision?
So one of the things is a matter of semantics. People don't know that there are different procedures to fix, and some are safe, some are safer, but they're not for everybody. So one of the most important educational things I do in this time I spend is to talk about what 2 major procedures there are, and I literally do 50-50, and why one may be better than the other for somebody. So here are the two procedures. So one of them is called PRK, and the other is called LASIK. A lot of people say LASIK, and what they really mean is laser vision correction that encompasses both. But the same laser that fixes you, but in two different places on your eye. So what happens is, here's your cornea. This is the place to fix your eye, to change the shape, to change the way light rays come through your eye, to uniquely fix you. I will be getting custom wave print numbers, custom view numbers on you of your unique visual aberration, and I get them on the day of the procedure, which is unusual. I will hand pick them and hand design them. So not only will I spend 2 hours with you examining you to know you're a candidate, but even on the day of the procedure, we're doing other tests, the numbers that I actually fix you with. So this is all part of the extra time to get optimal results. So what are the two procedures? PRK, LASIK. LASIK, we make a laser flap. We then correct your prescription with the excimer laser underneath to fix your unique visual aberration, then we put the flap back down. That's the one you see the quickest. 99% of my patients go to work out, and drive the next day. PRK is the slower procedure. We don't make no flap, no cut, no laser cut, incredibly precise laser cut, which is with the intralase laser to make the flap. We just use the excimer laser that fixes your prescription on the top. But if we do that on the top, it's a slower healing process. I say to my patients, you love me slower. So you get about 80% of your vision initially, and then the last 20% over weeks and months. Because when we laser on the top, we create an abrasion. We put a Band-Aid contact lens on your eye, regular contact with no prescription. And then we let the skin, the epithelium heal, the contact comes off. You go to work the next day, but you increase the font size on your computer and smartphone for the first 4 to 6 weeks. Steroid drops for a few months as opposed to a week or two with LASIK. Day 3 with PRK, you want to miss work because that's the day the nerves wake up, you're a little uncomfortable. And with PRK, usually I tell people to avoid driving for a few weeks. I do PRK on people who work on computers 10 hours a day, and they go back to work, and I have people of all different professions, but you're going to, as I say, love me a little slower, and who are those people who I'm going to do the PRK for, and who are the people I'm going to do LASIK for? Well, in LASIK, you need a certain thickness, a certain shape. If in the screening tests that I'm not sure which of the procedures is maybe best for you, I may lean to the safer procedure. Or a lot of my millennials, and I'm sure a lot of you who are watching this are millennials, they just don't kind of like the idea of making a laser flap. They choose the slower procedure called PRK. So PRK is slower. If I have a question on some of the screening tests, I lean to PRK. And I do 50% LASIK, 50% PRK. This is not one that's so unusual. Sometimes I will only offer one to a patient. Sometimes the patients will choose. If they're a candidate for both, they'll choose PRK. And remember, 20% of you, you're going to feel a little sad, but I'm going to turn you away. And it's going to take a while for me to know that you are or not a good candidate. I want to make sure when you come here, I answer every one of your questions.
All right. Thank you so much, Dr. Mandel, and thank you to all of our Facebook fans for joining us today. Remember, if you'd like to meet with Dr. Mandel personally, to find out if you are a good candidate for LASIK or PRK, you can either book online by visiting our website at mandelvision.com, or you can call us here at the office and we'll be happy to help you with it personally at 212-734-0111. Thanks so much.